Welcome to Health Sciences Update. I'm Taryn Roloff, Communications Director for WSU Spokane, and I'm thrilled today to be with our newish Dean of the College of Nursing, Dean Griffin-Sobel. Thank you so much for joining me.
My pleasure.
And welcome to WSU and to the Health Sciences campus.
Thank you. I'm delighted to be here.
So can you tell us a little bit about your background and what drew you to WSU?
So I was in a deanship in New York State, upstate New York. I'm from New York. It's very obvious in the way I speak. And I wanted a place that really wanted to push forward with interprofessional education, which I believe is the future for health professional education, and really the only option that we have if we're ever going to address medical errors in this country. And when I looked here, it was a little far for me to think about Spokane. But when I looked here, the university wanted to do exactly the kinds of things that I wanted to do with the College of Nursing. They wanted a great deal of interprofessional education. They wanted to grow their research. I liked the fact that there were multiple campuses, so you really could have a statewide impact in the kind of nurse that we produce. So it just fit all my checklists. And after I took my husband into having a bi-coastal lifestyle, because he's still in New York, I accepted it, and I'm delighted I did. So I started the last week of April, so coming on 5 months, and it has been a whirlwind, to say the least, but a great time.
That's great. And I know one of the things you were interested in as well is simulation. And we happen to be in the sim lab, or the simulation labs. Do you want to talk just a little bit about your thoughts on simulation and how that's an important part of nursing as well?
I've been involved in simulation right from the beginning, and to me it's one of the most effective pedagogies or a teaching learning strategy that we use in a clinical profession. There are so many different kinds that really can fit the educational needs of so many situations for both undergraduate and graduate students. And for interprofessional education, there's nothing better than simulation. I personally loved standardized patients, where we have actors who are trained in medical conditions who enact situations, and we allow the students in teams, interprofessional teams, to work with that patient. And it really allows the student to develop those communication skills that are so essential to communicating in a team, learning what other professionals do, and it really is so effective. Here, I was delighted when I came here to see the extent of our simulation. We have a nationally recognized leader of simulation in Kevin Stevens, and our labs are lovely. I do want to expand our labs. I do want to expand the amount of video playback that we have for the students, because oftentimes it's a very effective learning strategy for a student to watch themselves on tape, even though tape is an old word, I know, but to watch themselves on video and see how they actually performed as it would be seen by the patient. So simulation is a big focus of mine for increasing both across our undergrad program and our graduate programs as well. There's a lot that a graduate student can learn in the sim lab.
The sim man behind us, or I'm not sure if it's a man or a woman today.
They're ambidextrous.
Yes,
we can make them whatever we need to.
What kind of things does he or she do in this, whatever case it is?
The mannequins themselves?
Right.
Well, the mannequins themselves, there's low fidelity that just pretty much lie there, and those are the Resusci-Annie kind of mannequins, and those are good for certain basic skills that you want to teach a student. The higher fidelity mannequins can do lots of things. They breathe, their eyes blink, their jaws can move, you can do venipunctures on them, they can have a cardiac arrest. The mannequins for children have seizures, they turn blue, very similar things to what a child might do in a seizure. So they have the capacity to allow you to teach a higher level skill or an emergency situation. And particularly for clinical situations that you don't see routinely in the hospital, the sim lab is invaluable. For instance, many students will spend 8 hours, 16 hours, 24 hours in their clinical rotation waiting for somebody to deliver a baby. And of course, no one ever does that on schedule. So the fact that we have a mannequin that can deliver a baby, these students at least see the mechanics of a delivery situation. So those are great. And then when we want to look at communication, when we want to look at team behavior and teaching students how to communicate across a difficult situation, a medical error, let's say, a drug error, those standardized patients are just the greatest. And they are so realistic that a group that we used in New York City, where there are lots of unemployed actors, and so we had a very large troupe of actors, they were so realistic that the faculty would be crying during some of these situations. It's really effective. And so we do need more space for that, so it's one of the things that I'm working on. And obviously our fundraising is always top priority for those kind of things.
Talk a little bit more about the interprofessional aspect that you were really excited about coming here for because you believe so strongly in that.
What was exciting to me was that it was a medical school that was going to be developing from the ground up. And usually when you go into a deanship, everything is already established. Everybody's got their schedules. It's very hard to move any of that forward or sideways or any such way. The fact that we have something just developing now gives us unbelievable opportunities. We've been able to negotiate time every month for every week, actually, for interprofessional activities, and all 3 deans have agreed to that. So medicine, pharmacy, nursing will all have Friday afternoons set aside for our interprofessional activity. That is often the biggest challenge for doing interprofessional education, is when, because our schedules are so full and they're so inflexible oftentimes, that to be able to do that I thought was a terrific step. All 3 deans are very committed to it. The university is committed to it. Our clinical partners, the more that we talk to them, understand that that team behavior, those communication skills, are the key to reducing medical errors, which kill over 100,000 people a year. And so it is a serious, serious problem, and we can't just act as if interprofessional education is a nice option for us. It's absolutely a mandate if we're going to do anything to decrease the medical error rate in this country. So we want to make sure that our students are really competent, really skilled in those before we set them loose with patients.
All right. And research, another area that I know you're very interested in.
Yes, and we do want to grow our research, and we have been talking a lot since I arrived about how to do that. I brought in a fabulous consultant from Case Western who has quite the portfolio, and so she is really developing strategies with us as a school in order to move it forward. We want to develop teams around certain clinical areas. We want a teaching learning cohort because that research really needs to be done. What is the most effective way to integrate simulation? What are the best strategies to use with a large class? That kind of research really needs to occur. So we have a group who's looking at that. We have groups that are looking at addiction, and we're really looking at chronic care conditions, wound care, pain, those things that so terribly impact the quality of life of patients with chronic illness. So those are the research teams we want to build, and I will support that any way that I can.
Excellent. Okay, so what are some of the challenges you're thinking that the College of Nursing has?
We have to collaborate now. There is no longer an option for a College of Nursing to be by itself, doing its own thing, and just going about in isolation. Medicine can't do it, pharmacy can't do it. We must collaborate. And we need to collaborate across universities. It can't just be one university in itself. We can't get the federal funding that way. We have to have these transdisciplinary kinds of teams. And so developing those collaborations, getting people to know each other. And one technique I like is sort of a speed dating, where the faculty come and spend 5 or 10 minutes with faculty from different schools and different disciplines and talk about ways that they could possibly collaborate. So we're looking at really concrete ways to help junior faculty move along, to be in a team, and to progress towards funding, which is so hard to get anymore. It's so competitive. So that is a big strategy for us, a big priority.
Right. we didn't talk about this before, but what kind of expansion do you see with regard to the other campuses?
Yes. I do want to grow enrollment in the college. We are the largest producer of nurses in Washington State, and I would like to increase that. The need for nurses is exponentially growing, and by 2020 we will be severely in another shortage. And so each campus has a role in growing enrollment around their area. Yakima is a fabulous place. They have great hospitals that are really eager to work with us, and we're already talking about some different models in Yakima to increase the number of graduates, not only with a bachelor's degree, but with a master's degree as well there. Tri-Cities and Vancouver have very strong programs. I've made each of the academic directors on those campuses associate deans within the College of Nursing so that they have a formal role in the leadership of the college because I see all of the campuses as one college. We are one college across multiple sites. And that's a bit of a challenge. It has been a challenge in the past. So we're working hard on communication, how we can really make sure that we all know what we're doing, that we're functioning as one unit. And of course, there's individual variations across those campuses, and that's fine. But the strategy of the college is the strategy of the college, no matter where your site is.
Right. So with the different campuses, how are you working on communication? Because that probably is a little bit difficult.
It was a bit difficult. The first thing we did was we brought everybody here for a 2-day workshop right at the beginning of the semester in August. So everybody came, we put them up in hotels, and we had a wonderful time. The faculty told me they met people that they had never met before. They've only seen on the AMS video system, and so it was tremendous. And we started our strategic planning while everybody was here looking at our priorities and how we were going to strategize for them. So I want to do that at least once a semester, to have everybody here. And hopefully we can move it in other sites rather than just Spokane, but it was too hard to arrange the first time in a hurry on another campus. But hopefully we'll be able to move that out. But I thought it was very effective, and I send out voluminous amounts of emails to keep people up to date on what's going on and how they can be involved. And people are communicating with me all the time too. So.
And those campuses are Tri-Cities, Vancouver.
Walla Walla, we have a very small little site there, and Yakima.
Very good.
Yeah, and Everett will develop at some point, and we have a few students in Puyallup, which they've been tutoring me for weeks on how to pronounce.
All right. Well, thank you so much for joining us today.
My pleasure. It was terrific.
And thank you for joining us on this edition of Health Sciences Update.